It felt like we were driving in a car, but the windows were fogged. And nobody in the car knew where we should be going. But we knew that we needed to keep driving.
We had no choice. We had to do it. This is our job. This is what we know how to do best. As scary and as daunting as it seemed initially, we know this is something that we had to do.
And so standing in the middle of the COVID ICU and you have patients that are refractory with their oxygen levels being super low, and you have to tell your teammates, I don't know what else to do. We've done everything that we possibly can do, and it's just, you just kind of feel like you can't help, and that's kind of like the most defeating feeling.
The patients would almost always ask me, and they would almost always say, I'm not going to survive, am I? And it was that realization that a lot of patients had. They were so sick that they may not come through this, and that was really heartbreaking and very difficult as, you know, being a physician to kind of look someone in the eye and have that conversation.
We didn't know what the next week or month or year would look like. We didn't know what that would look like for us as healthcare providers in America. We didn't know what that would look like for our patients or for their families.
We have certainly learned a lot from the early days of this disease up until now. There's a whole lot of data. We certainly do have a better understanding.
We are seeing the evolution of the course. We're seeing patients get better and leave the hospital and stay out of the hospital, and seeing that is really what keeps us going.
There's always hope, whatever long or short, if the few patients that we have now, and this is the little break that we have, I'm recharged. I've had enough time, and like I said, the support system that I have with not only the people and colleagues that I work with, but my family and my friends, and the side hobbies that I do. I skate a lot, so that kind of helps with the energy.
There's always hope, and that's why we do what we do. We've seen the patients who have defied the odds and defied death, the miracles that have come through insurmountable odds. So there's always hope.